Hi, I'm Dr. Nicole Anderson, and welcome to this installment of Hacks to Stop Back Attacks. So, a big cause of people having back pain is because their transverse abdominis is underactive and the lumbar multifidi are also underactive. And so lumbar multifidi are these little muscles that are segmental muscles that stabilize your spine right next to the spine, and the transverse abdominis is in the front. So lumbar multifidi are in the back in kind of like that groove right next to your spine, and they're deep. You can't actually touch them. And then transverse abdominis is in the front, okay? So a good way to test and see if your transverse abdominis is on the way it's supposed to be, or if your lumbar multifidi are working the way they're supposed to, is a couple of exercises. So this is one of them. So one of the exercises you would do is you would rest on the ground, okay, and you should have a neutral spine. There should be a little bit of an arch in your lower back, all right? And then you make a shh sound, and you'll draw your belly button in. And when you draw on your belly button, making that shh sound, that's gonna activate transverse abdominis. By making the sound, it forces you to activate transverse abdominis just a little bit more. It's like if you were to just bend your arm like this, that's gonna make you use your bicep, but if you put a weight in your hand and do it, now it's gonna make it use it even more. So same thing here, I could draw my belly button down and in, but if I make a shh sound, it's gonna make me use the muscle harder, okay? What I wanna do is draw that belly button down and in without my back flattening into the ground, okay? So there should still be a small arch in my lower back shh, while I'm doing this move, okay? Then I'm gonna hold it there, and I can continue to breathe as I hold that muscle in, and I'm gonna lift one leg, and I should be able to keep my belly button drawn in, and if you can't, then that's a problem. That means that you have some weakness that could be causing your back pain, all right? The way I advise you to do it is make your shh sound and move your leg while you're making the sound. That way you can be sure you're doing it right. Okay, do it on both sides and see if one side's weaker than the other, okay? Then, if you're good there and you're able to stabilize and maintain it, then you're gonna do it with your legs up in the air. So you're gonna make your shh sound and hold your legs up like this, okay? And you should be able to maintain that belly button drawn down and in, shh, nice and tight, and your lower back still a little tiny bit of an arch. And so you should really be able to suck in your abs, all right? And you should feel it come down. If you put your hands on your ribs, you should feel it kind of, the muscles squeezing down and in, right? That means you've got transverse abdominis activated. Okay, good. So if you can hold here for 30 seconds and not lose it, then that's a good step. But you should also be able to bring your leg down and up without losing it, okay? So if you're good here for 30 seconds, then rest and then try moving your legs, okay, to see if you can still stabilize. And if you can't, that means you have a weak transverse abdominis. You're losing 30% of your total power, which is an important thing for athletes, but it's important for anyone. Your total strength of your back, 30% is gone if you don't have transverse abdominis, and you're set up to have back pain because transverse abdominis works with your lumbar multifidus, okay? Now lumbar multifidus, we want to test that to see if your lumbar multifidus are on, okay? So this is how you would test to see if your lumbar multifidus are on the way they're supposed to be. So remember, they work with transverse abdominis. So if transverse abdominis isn't working well, these guys aren't going to work well, and vice versa, okay? So if I want to test lumbar multifidus, then what I'm going to do is I'm going to have my fingers in that little trough in my back, okay? So if I bring my fingers right next to my spine here, and I palpate, meaning poke and touch. That's our fancy word for poke and touch. So, I'm going to put my fingers really low, all right? And I'm going to squeeze my butt on the opposite side and lift my leg, all right? And I should feel something bump into my fingertips here. My fingers are in the trough there, and something should bump into my fingertips. All right, so my fingers are not on the spine and they're not on the big muscle on the side. They're right next to the spine, okay? And like I said, I should feel something bump into it. That's the lumbar multifidus turning on, okay? And do it on both sides. And then you wanna do it all the way up. Check and see. Do I have a sleepy one? Do I have a segment that's sleepy? Okay? And if you do, that means that you probably need to target that, which would be another episode of Hacks to Stop Back Attacks, where I teach you how to target one segment at a time in your back to really, if you have a lumbar multifidus segment that's really weak, there's an exercise that's really good for targeting. There's actually several. But if you do have a weak segment, then you're gonna wanna do more than just target just that segment. You're gonna want to have a comprehensive program, because if you've had a weak segment for any length of time, your body's been compensating and there's gonna be problems in multiple places. There's probably gonna be scar tissue that has built up in some spots. And so you're gonna need some specific types of therapy to break up that scar tissue. There's probably going to be some compensations. Maybe some muscles are weak, some muscles are really tight, some muscles are too long. These are all the problems that we see when somebody has a weak transverse abdominis and a weak segment or two in their back. And so if you find that that's you, yeah, you can try a few of the exercises that we have available on YouTube and stuff, but definitely come down to the clinic. That's going to be the best way for you to identify exactly what is going to be the best course of action for you to solve that back pain or leg pain if it's coming from your back permanently, so that it doesn't keep coming back on attack.